What is atherosclerosis? Atherosclerosis is a thickening of the arteries caused by a buildup of fats, cholesterol, and other substances on the inside wall of an artery. These formations are called plaque and can cause arteries to narrow, hindering and blocking blood flow. Atherosclerosis is frequently the cause of heart attacks, strokes, and other cardiovascular diseases. However, it can also affect arteries anywhere in the body and develop asymptomatically. To better understand how to identify atherosclerosis, watch this video to the end. What are the causes of atherosclerosis? Atherosclerosis begins with damage to the inner layer of an artery. Common causes include high cholesterol and triglyceride levels in the blood, high blood pressure, smoking, diabetes, obesity, physical inactivity. What are the symptoms of atherosclerosis? Symptoms may depend on which artery is narrowed or blocked. Symptoms related to coronary arteries, risk of heart attack, arrhythmia, pain or pressure in the upper body, including the chest, arms, neck, or jaw, angina, and difficulty breathing. Symptoms related to the arteries that carry blood to the brain, risk of stroke, numbness or weakness in the arms or legs, difficulty speaking, sagging of facial muscles, paralysis, severe headache, vision problems. Symptoms related to the arteries of the arms, legs, and pelvis, pain in the leg when walking, numbness. Can atherosclerosis be cured? Atherosclerosis is treatable with medication. A healthy diet, weight loss, physical activity, and quitting smoking can help reduce your risk of atherosclerosis and ease the course of the disease. Watch our videos on how to lose weight or how to fight cholesterol by clicking the links in the description. We wish you good health.